Now I think we've got the right house.
Chris is in Melbourne to try to sort out a problem with a very vocal Cavoodle.
You, Lola? Hey? I'm told that Lola has some bad antisocial behaviour that needs addressing. I'm not so sure if this is it or if there's still more to come.
Hi, Chris, come on in. She won't bite. There we go.
Hilarious.
I know, she's just got this little tiny...
Intimidating.
Owner Serena is desperate to find a cure for the 5-year-old's outrageous antics.
When people sit on our couch, she jumps up next to them and starts humping their arm.
I noticed that I've managed to get in through the gate, you know, thankfully with my life intact. There was no humping of legs.
She doesn't do the legs at all. It's just the arm when people are seated.
How long has she done this for?
She's 5 now, and probably since she was about 4 months old.
Okay. So it's always been a pretty big part of her.
It is.
Having my arm humped isn't anything I ever thought would be happening today. But if I am going to help out Lola and Serena, it is important I see Lola in action. I can't believe I'm willingly putting myself in the hot seat, quite literally, but she's going to be offended if she doesn't do it.
So will I.
Oh, she's getting nervous. I'm getting nervous too. It's a good sign, right? This is just a foreplay.
I think so. I think so.
I'm sitting down. Lola's doing a lot of talking, but as for getting amorous, nothing so far. She'd like it if I talk or just stay quiet?
Just, maybe just play with her a bit.
Hey.
She's growling, she's circling a bit. Lola wants his attention and she's just so loud.
All the pursuit of science, Lola, come on. I'm just going to sit back and just,
There we go.
Wow. Career high point. I don't get paid enough for this.
In Melbourne, Chris is getting a full-on demonstration of Lola's disturbing behaviour with visitors.
I really don't get paid enough for this. This is certainly not the typical house visit. When I first arrived and met Lola, she was all talk and no action. Now she's no talk and all action. And what action? In many respects, it's fascinating to start with when you have a desexed female dog.
Yeah.
Not just desexed, but female. Humping.
Yeah.
Because humping isn't something we normally associate with females at all. A lot of people think that when they see a dog that's humping, then it automatically must be a sexual thing. Well, often it's not. So the crucial thing here is working out Lola's motivation. I just want to try something.
Okay.
I'm making a lot of eye contact at the moment. She's not doing it. But we'll just see what happens when I go over here and look over here and start talking to no one in particular. And
Here we go.
look what happens. I'm starting to wonder whether Lola's antics are actually her way of getting attention. So there's really two things we have to look at. The humping, sure, because Lola, I hate to say, it's a little antisocial, a little forward. And the barking.
Yes.
Because that's not exactly pleasant when you're sitting at home trying to relax. Thank you.
We can clown around and say this is funny, it's cute and it's engaging, but in fact I think it's about a dog that's in distress, and as her owner, I don't want that for my pet.
Dogs are very different inside versus outside. We need to get the whole Lola picture.
All right.
Could we go for a bit of a walk?
Yeah, sure.
All right.
Yeah, let's do that.
The fact is, this behaviour does need to be controlled. So the whole idea now is to take her out of her territory and see what happens. Hopefully, that'll give me a clue about how I can fix it. There's not a sound, is there?
No, she just really enjoys her walk. She just wanders along.
In Melbourne, Chris is trying an unusual approach in a bid to solve Lola's antisocial humping behaviour.
Butter wouldn't melt.
I know, she's like the perfect dog in public.
And this isn't what I expect from a dog that just put on such a show.
Yep.
And was so loud.
It's so incongruent, isn't it? It's really, the many shades of Lola.
The amazing thing is you take Lola out of the house where she feels like she has total control over everyone, and all of a sudden, we've got a different dog. There's no barking, and there's certainly no humping. With all sorts of behavioural problems that you see as a vet, I'd say the majority of them involve either dominance, territorial behaviour, attention seeking, pretty much those three. She's actually got all three of those.
She's the trifecta.
She is. Yeah. This double life that Lola's leading, where she's well behaved outdoors but poorly behaved indoors, it's not fooling me. Even though this has only been a short walk, it's given me enough time to come up with a solution that I'm pretty sure is going to end Lola's humping ways forever. I'm going to meet you back at your place with my solution.
Alrighty, thanks, Chris.
I'll see you soon.
Come on, pups.
Hello. Yes, the game's up.
In Melbourne, Chris is about to dish out some tough love to Lola.
How Serena has put up with Lola's behaviour for all this time, I have absolutely no idea, but I'm quite sure she's really going to appreciate the solution that I've got in mind. Let me guess. Yep. Right back to where it all began. So, I've come up with something that is going to change the rules around here.
Okay.
It's high tech. Highly expensive.
Right.
That's going to blow your mind. You ready?
I'm totally ready. A leash.
A dog leash.
Right. We have one of those. Yes.
This one is now her inside leash.
Right.
The idea behind an inside leash is actually pretty simple. It gives Serena back her control and means she can correct Lola without touching her, without talking to her, without giving her any attention whatsoever. So, the moment the bad behaviour starts again, get the end of the leash, haven't looked at her, haven't talked to her, and now get hold of her, and we walk her, whether she likes it or not, in here, and shut the door.
Right. So Chris puts her in the laundry. She's in there for 3 or 4 minutes. Not a peep out of Lola, which is so unusual. Okay.
So we'll go back up here.
Okay.
I can't believe it. We have silence. Immediately, there's not a lot of interest.
I think Chris has nailed it, and it's down to me to help her with this.
So it's the start.
It is. It's a great start.
And let's hope that is all it needs.
Alrighty. Okay. Thanks, Chris.
Thanks, Serena.
Thank you.
My pleasure. I was expecting a result, but this is pretty much instantaneous. All of a sudden, Serena is now back in control, all thanks to a leash. A lot of people think leashes are just for outdoors, but indoors, they can be pretty effective too.
Hey, you want to say goodbye? No, I think she's over you. It was beautiful while it lasted.
It was special. I'll never forget you, Lola. Thank you.
See you, Chris.
See you later.
Bye-bye. Hey, come here. Say goodbye.
Hey, so Audrey, thanks for having me. I'm loving your clinic on wheels. It's very cool.
It's like my little mobile office.
Scott has teamed up with Sydney-based colleague Audrey for an unusual case not far from Bondi Beach.
First one off the rank is a really interesting patient.
Okay.
With an interesting problem.
Right.
As a mobile vet, we see all types of patients, but today I've got a very special patient of mine. It's a bit of a tricky one, a little bit strange, so I've got Dr. Scott here with me to help me with this problem. It's a cat called Sooty who has a strange love affair with his emoji pillow.
Love affair?
Love affair.
What
and
do you
by
mean?
love affair, I mean a very inappropriate love affair with his pillow.
I'm really excited to be working alongside my veterinary colleague, Dr. Audrey. We are travelling to one of her patients who is producing some rather intriguing behaviours that her owner is quite concerned about. So this is Sooty's boudoir.
Yes, this is the main place of action.
And
there's the
pillow.
cushion. Oh, it's a cool face emoji. He's looking a bit grumpy as well, isn't he? We've definitely interrupted him.
We love Sooty. He's a big part of the family. He's got such a big personality. But he has had a few little personality issues, I should say.
You're looking a bit sheepish there, mate.
He is. Look at him.
Owner Cynthia is desperate for a solution to her 4-year-old's X-rated habits.
And how often is it happening?
every second night or so.
Second night.
Wow.
Sooty will approach either an emoji pillow or my leg or an arm, and he will start humping. And it can become quite aggressive, especially if he puts his teeth on you to hold you in place. And I find it quite uncomfortable. And it's usually me that he does it to. He'll do it on the bed, on my leg,
Oh.
or on
Lovely.
my arm. I don't know if you can see that.
Cynthia shows them graphic evidence of what she's dealing with.
Wow.
Whilst it started off with just the pillow, it's now progressing to his owner's legs, his owner's arms, and it's becoming quite aggressive. So we really need to get to the bottom of it.
It's the thrusting that's just so wrong. It's just not right, is it? Oh my gosh, well, I've got a black cat and he's a male. Thankfully, no cushion bothering going on in the Miller household. Thank goodness for that. It is completely natural and human nature to laugh at something like this, but there generally is a serious medical or behavioural reason behind it. And so we need to then put our veterinary hats on. You've got a dog, a bouncy dog, in your environment. What other animals do you have here?
So we have Sooty and his sister Misty, and we have 2 little rats as well.
Wow.
How about outside? Is there any building work going on?
We did have a building out the back though, and now there's building down the road, so that might have something to do with it, that he can't roam as freely.
So he's a keen outdoor cat.
Yes.
So certainly a lot of environmental stress around that could be contributing to his anxiety or the need to try and gratify himself. Let's have a check over him. I think we want to rule out anything medical. So blood tests, urine tests, full physical exam.
Yeah.
If
we can catch him. Yes, wily little man. All right, well, should we try and go on the hunt for Sooty then?
I think
Let's
so.
do it.
Okay, come on then.
All right, you going to help us find him?
Come on, you. Yeah. Come on then, let's go. I know he's embarrassed.
Can you just tell him to come?
Come on.
Not too keen on all the attention, Sooty's done a runner.
Come on, buddy.
Sooty's run away, he's hiding under the bed, and obviously he's uncomfortable because we've intruded his private space, so it's going to be a bit of an effort to get him out from under the bed.
You're small. Audrey, go on.
Oh, I probably could.
Go on. Go for it.
Tunnel flexibility.
You'll never get me out if I go in there. Come on. I'll pull you by the legs when you've got him, okay? You got him?
Yeah, got
Okay,
him.
you ready?
Yeah,
okay,
yeah.
I'm going to pull you by the legs.
Okay, go.
Ready?
Go.
That's it, you got him? Oh, she's got him. Okay, buddy.
Okay.
Here we go. Ready?
Train box up here.
Okay. Bum in first. That's always the way to get a cat in a box.
Good job.
Yes. Well done. Normally in my veterinary practice, I'm surrounded by nurses in a clinical environment. And here I am with Audrey. And what am I doing? I am grappling underneath the bed and grabbing hold of a cat and then pulling it by the legs. So definitely not the normal day, but clearly it is for a mobile vet. I'm glad you're doing the heavy lifting, although I'd rather be carrying the cat.
Scott and Audrey will perform a general health check on the Persian cross before testing his blood and urine for any signs of a medical explanation for his unusual behaviour.
Yeah.
All right, let's start at the head end. How's your teeth, buddy? Okay.
Pretty good.
All right, you want to check out the back end?
Yeah, okay, so he's a little bit on the nervous side, isn't he? So the good news is we've got a bladder.
Great.
So I'll be able to get a urine sample, so that's good. Now, can we just have a look at your man parts and just see if there's anything going on back here?
Grooming for that.
Yeah, so he's licking in that area for sure, isn't he? All right, buddy.
Okay, all right, hold on. All right, we'll put your happy pillow right there, okay?
Are you happy your pillow's here? And the gears?
He's very happy the pillow's here.
Yeah, I mean, there's nothing abnormal.
Not blue.
No. It doesn't look sore or irritated or inflamed at all. It looks
Your man part's all right, buddy.
all normal. So I feel his male parts just to see, is he causing them injury as a result of this excessive rubbing, which he doesn't seem to be. But what we do find is that there is some patches of hair loss on his tummy. Now that would indicate it's more likely to be an anxious or a behavioural cause than a medical one.
All right, so we'll take some blood, take some urine, and send that off to the lab.
Sounds like a good plan.
All right, buddy.
Right, should we do that? Yeah.
Although they suspect the 4-year-old's obsessive humping doesn't have a medical cause,
Do you want to do the blood or do you want to do the urine?
I'll do the urine as I'm at the back end.
You do the urine end. He's doing all that bit.
Scott and Audrey must rule it out before determining how to treat the disconcerting problem.
He's a good boy.
I'm taking blood from Sooty because I'm really interested to see if there's any hormonal abnormalities there. If he has high testosterone in his blood, that could explain why he's doing that sexual behaviour of humping. Thank you, buddy.
Boy, well done.
You're a good boy.
Good boy, well done.
Scott now takes a urine sample.
Good boy.
Is that me or the cat?
Both of you.
Oh,
Good
thank
job.
you.
Good boys.
Thank you.
Good boys.
which should reveal if Sooty has an infection.
No glucose, he's not diabetic.
Okay, no signs of infection, which is good.
Yeah.
So, looking more behavioural.
Yeah, definitely. We finished with all the tests on Sooty. I think that it is a behavioural problem as a result of anxiety rather than a medical one. And hopefully with the results, we'll be able to produce a plan which means that Sooty and that cushion have less of the intimate relationship that they're currently enjoying.
Right, let's go.
I'll take the patient. Come on, boy, let's bring you home.
The samples will be sent for analysis, and Audrey will be back to visit the family in a week with the results. And a week later, Audrey is about to give Cynthia the all-important results of Sooty's blood and urine tests.
I've got some results back for you. Now, it is bad news in the sense that we can't treat it because it's not a medical problem. Okay. Urine came back clear, there's no signs of infection. Bloods came back clear, there's nothing going on in the inside, and there's definitely no excess hormones or testosterone that might be causing the humping issue. So we're back to environmental, behavioural, those kind of things.
So I'm glad in a way that it's not medical. So there's nothing actually wrong with him, but then that puts the onus back on us to fix his environment. And we've been working on a few things, new toys, and just trying to get him a bit more sort of involved with the family.
So a lot of work to do in terms of toys and environment, but I think it's possible. With time, you'll find out what he likes to play with, where he likes to go, and then you can sort of modify from there. Unfortunately, it's not a quick fix for Sooty. We are looking at behavioural issues which take some time, some toys, some environmental enrichment, and I'll touch base with Cynthia in the future. But hopefully, we can stop this undesired behaviour. It's just not on Sooty.
So this is where the action's happening?
Yes, this is where they live. They're free range in the backyard.
After feeding Frank, Chris is on the road to answer an SOS call from Linda.
So he just hassles her and just...
Yes.
When he's not in his little chastity cage, he's...
Yes, he jumps on her a lot. He tries to make babies. Do you want me to get him out?
I wouldn't mind seeing it.
Bunny's fallen in love with his Flemish giant flatmate. He just won't leave 5-year-old Archelina alone.
So, Chris, you can see the problems we're having.
Fairly, I don't know, I mean, it's a pretty subtle gesture that Bunny...
Naughty Bunny, naughty boy, naughty.
The thing about rabbits is they grow up very fast. They're sexually mature from 8 weeks of age. He's 4 months of age, so he's almost in his prime.
But, Chris, you must know yourself how awful it is when you get unwanted attention from the opposite sex. So it's horrible, isn't it?
I wouldn't know what you're talking about. I've never had unwanted attention of that variety, if that's what you mean.
Poor Archie, look. It's disgusting. And it gets very tiresome for Archie. Oh dear, Bunny, stop it.
So we need to castrate him.
Okay, wow. But he's a bit small, isn't he?
No, they're there.
They're there.
Oh,
That's
there.
good. Okay.
Yeah.
Oop, he doesn't like that.
So the only real solution here is the snip. Get rid of those hormones altogether and hopefully Bunny will start behaving himself. But that's no guarantee. You see, this could be dominance related rather than hormone related. If that's the case, then Bunny needs a new address.
Bunny, put it away. Oh, he's very upset.
Well, at least we've got it on video, huh? You can look back on the good days.
Yes.
At the clinic, the love-struck Bunny has arrived for his delicate operation.
You look after him, won't you?
I will, don't worry.
He is very special to us, despite his debauchery.
He's very special, I'll give you that.
I feel that I'm taking away his, his manhood, emasculating him. Same way my partner feels really most days.
Operating on a tiny subject like Bunny is difficult.
He's got this ability, even under anaesthetic, to actually suck them back in. So you touch them and he'll subconsciously pull them back into his body. So once you've got one, you hold on to it. That's it. One of the great careers cut tragically short. No more for Bunny.
Now the big question is, has the desexing worked? Will the giant Archelina finally live a peaceful life?
We won't know, probably even for another month or so, whether this has been a success.
As for Loverboy Bunny, the operation worked, and Archelina is one relieved rabbit.
He doesn't seem to be very interested in it all anymore. So he and Archie are just good friends now. It's purely platonic. Isn't it, Bun?
Hi, Marie. How are you?
Oh, I'm at my wit's end, honestly.
Okay, what's going on with Banu?
Banu is in season and she's driving me crazy. She's been slightly amorous with my husband, Tim.
What's she doing?
She's rubbing her bottom all over him. And then, just to get him in the mood, she nibbles his ear.
I feel like I've walked in on a bit of a girly chat here.
We're just talking about my amorous cat.
Oh, right. Like you do. Hello. Okay, come on in, Marie. Banu is an incredible looking cat. She's a Sphinx cat, which naturally have no hair. They've got big eyes. They look a little bit like aliens. And she is really quite unhappy.
It is hilarious as she tries to mount my husband.
Wow.
Nibble on his ears.
Oh, she's trying to nibble on me as we speak.
And, you know, she does favour, apart from you, unfortunately, she does favour the males at this time of the month.
Okay, and when you say favour, what are we talking?
Rubbing her bottom on him
Right.
and nibbling his ears.
Wow, it's quite intimate, isn't it?
It is.
Well, let's get you out and have a little look at you.
No, you're fine.
Hey, shall we pour you out? Hey, because you're a very emotional little lady at the moment, aren't you? There you go. Oh, wow. She's an amazing looking cat, isn't she?
Banu is a really affectionate cat. She's so loving most of the time.
Let's have a look at you. Okay. I know. Oh, dear. You are really in a mood today, aren't you? Dear me.
I think Scott's a bit scared. I'm not going to lie.
Oof. Hey? I love you, but I hate you.
I think he's slightly petrified of Banu.
When they can't enact their natural behaviours, they're going to get frustrated. Yeah. All right, baby.
I don't know whether she's in pain or not. I don't really understand it. But basically, what we have to do is we have to lock her in the bathroom with her litter, her cat food, and her bed. And it's the only place that she'll calm down.
Spaying will relieve Banu's torment, but first Scott must check if the frisky feline is healthy enough to undergo a general anaesthetic.
Normally when listening to animals' hearts, what we can hear in a healthy animal is lub-dub, lub-dub, lub-dub. All right, sweetheart. In the case of Banu, what I can hear is a small flutter, a little tiny sound, and that is not normal. It looks like her hormonal endeavours are going to have to continue for a little while because I can hear a heart murmur, which would suggest that part of her heart is abnormal.
Oh.
Heart murmurs really aren't very common in cats. It's like a ticking time bomb. One day they can be fine, and the next day they can be near death.
Oh.
But what also is a concern here is that, of course, to spay her, we need to give her an anaesthetic. And an anaesthetic in a cat with a heart murmur is very risky indeed. It increases the risk dramatically.
Okay.
So, unfortunately for now, you and your husband have to deal with that moody behaviour for a little longer.
Oh.
Banu will now need to go to Scott's referral hospital, the Royal Veterinary College, for a heart scan.
If they find at the Royal Veterinary College that she has an abnormality in the heart that's significant, then surgery may be the only option to allow Banu to live a normal, healthy life. So Marie has got a very difficult and tricky time ahead of her.
I'm pretty upset considering that Banu can actually die from this. I came in laughing this morning and now I'm leaving really, really worried.
Oh, it's okay, Banu. We're gonna get you sorted, okay? Let's go. Come on. Oh, it's okay.
At the Royal Veterinary College, Marie has arrived with her grumpy Sphinx cat for Banu's appointment with cardiologist Ilaria Speller.
Hello, you right?
Yes, Marie.
I'm Ilaria, nice to meet you. Who we have here today?
This is Banu.
Hello,
We've come to get her
Banu.
heart checked.
So we are ready to go.
Great,
Please
thank
come
you.
follow me.
Today, a scan will determine if it's safe for surgery to go ahead.
If Banu can't get spayed, it's going to be really stressful for the family and for Banu. But our main priority just now is the heart murmur and making sure that she's okay.
Oh, I love you. I know. It's all very scary, isn't it?
Banu is a big part of our family. Everybody adores her and loves her. So to think there might be something seriously wrong with her is really scary.
Okay, Banu, are you ready? Good girl. Some cats have murmurs that are not related to any disease, and some other cats unfortunately have a murmur, and that may impact their life expectancy and long-term prognosis. Oh no, we're sorry.
True to her recent form with Scott, Banu is proving to be a handful for the medical team conducting the scan.
Yes. She bit my nose.
I know, that's called jelly.
Here.
You tell us.
Oh, I know.
I feel really nervous. I've got butterflies, and I think that's just not knowing what Ilaria's going to tell me about Banu's condition.
Ilaria, here we go. Baby, mommy's here. What we found during the scan is that she's got a little hole in her heart.
Okay.
But the hole was sealed. So we went hunting for other causes of the murmur, and we couldn't find any other. So the good news is that her murmur is not associated with any disease. So she doesn't need, any
Surgery.
treatment. She can go ahead with surgery. She can be spayed. There is no evidence of any abnormalities, and that is really good news. She's got normal life expectancy, no problems at all. We consider her heart to be normal.
I'm so relieved that her heart is fine because we love her so much. I just can't imagine anything bad happening to her. And now we can get her spayed, which is amazing. Oh, thank you so much. Thank you. I'll give you lots of cuddles tonight. Oh, brilliant. Oh.
With the all clear, Banu will now be booked in for surgery with Scott as soon as possible.
This is the best news that I've had all week. We've been so worried, and it is such a relief, and I just feel less stressed already.
Come on, let's get you home. Get you lots of treats.
Hey, Marie, how are you?
Good.
First of all, hug for great news.
Marie and Banu are back at the St Margaret's practice.
Well, we're not completely out of the woods, because obviously today we are going to have to spay her and try and reduce her sex-pestering ways.
The moody little miss can finally have the operation she needs to get her raging hormones under control.
We're just hoping from the operation that she can be her usual happy self that she is 9 times out of 10.
Come on.
Wow.
Beautiful jump.
Well, we're coming into colder times now. Yes, Mummy needs to get a matching one.
Banu comes out of the cage and is wearing a lovely knit jumper, of which Marie is very proud of. Knit jumpers on a Sphinx cat? Okay. Are we being serious with this? I mean, Banu, you look ridiculous.
What's wrong? She looks gorgeous.
Ooh, wow, she is loving me today. It was because I mentioned your fashion. You never comment on a lady's clothing.
Never diss a woman's fashion.
All fashion jokes aside, it is a serious day for this little lady. Now we just need to get you through this and hopefully you'll be a bit less cantankerous. Could you try? no. That's the answer. A resolute no.
No.
All right, do you want to say goodbye to Mummy?
Oh, bye-bye. Oh, I know. I love you. Banu is part of our family. She's like our fourth child. Everybody just adores her and loves her. I'll see you after. Be good. Well, okay. Bye. Bye, I'll see you later. Bye.
Bye, see you, Marie.
So obviously we're going to be worried about her today going under anaesthetic, but I know that she's in really, really good hands with Scott.
Come on then, Chuckles. Hi, Jess.
Hello. Oh, my goodness. Hello.
Yeah, very, very happy customer. I'm just hopeful that because you don't look dissimilar to her mum, that she might like you a little bit more than she likes me.
Hey, it's okay. Hey, Banu.
But Banu soon makes it clear that Jess is not going to placate her.
Whoa, wowza. Right, so because she is so mad and so stressed, rather than trying to give her an injection, I think it's best we just give her some gas, calm her down nicely, and then we can move forward with the spay. All right, so we're ready?
Well done.
Good girl. Oh,
All right.
no. Good girl. Even though we have proven that her heart is okay, I still think she is a patient that we want to watch very closely.
Oh, that's better.
That's the one. Okay, so she can just flop over there.
Banu is finally under, but it's not long before Scott is feeling even more pressure.
She's just not breathing right now. Sometimes they just go down quite deeply, and although the anaesthetic was given very, very gently, Banu has stopped breathing, and it's an emergency situation right there. Come on, take a breath. She's not breathing right now, so we just need to encourage her to do so. Good girl.
Is that her?
Is that her?
Yeah. There and again. Yay, good girl.
Okay. Yet again, Banu, you are trouble. Okay, that's much better. So Banu decided that she wasn't going to breathe for a little bit longer than is comfortable. So I think she just wanted me to sweat a bit. So.
Did you?
Oh yeah, yeah. You know, there's problems when Jess and I aren't saying anything.
When it's gone quiet, that's
when it's got quiet, then you know there's something. Yeah. Okay. I wonder if it's because I was mean to her about a jumper.
I was going to say, do you want to keep that on and we just tuck it up?
Just as long as you breathe, I don't care what you wear. Just, there we go. Breathing is good. Jumper optional.
With Banu now stable, the spaying of the highly strung Sphinx cat can safely begin.
All good up this end, Scott? Yep, happy.
Okay, so just about to cut.
The surgery involves removing both Banu's ovaries and much of her uterus.
So although this is a fairly routine procedure, I think for this cat it's going to make a huge difference to her quality of life. This is a very hormonal, very stressed little lady, and removing the factory for the hormones, the ovaries, is going to make all the difference in her life. There's one ovary there and you can see it's very active, and that this cat is a very hormonal girl right now. I have to be careful what I say. I'm surrounded by women, so I can't say anything bad. Yeah. Jess, we're all done. She can wake up.
Lovely.
All right. Don't know if she'll like me anymore before or after the surgery. It's so hard to tell.
We'll see.
I'm really happy that Banu has come through the anaesthetic. Initially a little bit of a scare for us, but she's come through perfectly fine, and she's going to recover from this and hopefully enjoy a hormone-free life.
Upstairs, Ona Marie is anxiously waiting for Banu to wake up.
I'm really excited to get her back and give her some cuddles and give her some TLC and know that she's okay.
Right, let's see how much happier you are after that spay. Oh, maybe not so much. Hey.
Although her reproductive organs have been removed, it will still take several weeks for Banu's hormone levels to settle down.
Come on. Banu, goodness. Wow. What was all that about? I must say I'm a little shocked at how Banu has behaved towards me. I'm hoping it's just hormones. And given a few weeks, once they've calmed down, I can go and see her at home and she'll give me a cuddle. Fingers crossed. Hi, Marie. Here's your little treasure.
Oh, hello, baby. What have they been doing? I know you're going to be so angry with me. Do you want to come and see Mommy?
Yeah, I think so.
Oh, I know.
Is wholeheartedly unimpressed
I know.
with me.
Oh, I know. It's okay. It feels really good to get Banu back. I've been worried all day about her, and just to see that she's okay is brilliant. Well, thank you so much for looking after her.
It's been a pleasure. Or has it been? It's certainly not been a pleasure for her, I can tell you that much.
Hopefully you'll meet her when she's a bit nicer. No frowning. Too young for Botox. Keep your face calm. Yeah, a good girl. See how happy she is, Jude? Yeah.
And 1 week after being spayed, Sphinx cat Banu finally appears to have calmed down.
Ooh, is that nice? Is that nice? Spot there. Good girl, Banu. We are so happy to have Banu home. Her recovery has been fantastic and she's calmer already. I know Scott said it would be a few weeks, but there's definitely a difference in her behaviour already.
But the big test is whether Banu will finally relent and give a warm welcome to Scott.
Hey, Marie, how are you?
Hello, Scott. Good. How are you?
Really well,
Nice
thanks.
to see you. You want to come
Trust
in?
you, well, I'll see. How do you feel things have gone? Do you feel like it's made a big difference?
It's made a really big difference. Already she's calmer. It's like she's happier. Like we've released her from the burden
Of hormones.
And she's like, I'm so much better.
And now the big test is to see if actually she is a bit more, well, nice to me. Can I sort of stroke you a little bit? Banu is reacting the way Banu does. She hates me. Oh, yeah, pound of flesh and all that. Oh. I think she really is unimpressed about my presence in her house and in her life generally, but I'm really happy to report that it seems like her life has got much better in the presence of Marie and the family. Oh, hello. Oh, well, that's an improvement. And you're going to launch. Oh, wow. I feel honoured.
Oh, that was progress.
That was progress, yeah.
That was big progress.
Yeah, I could touch her without her savaging me.
Put her head in the right spot, she lets you know.
Back at the Bondi Clinic, a new patient has arrived for Chris, a pet cockatiel called Cheeky.
We go almost everywhere together. Shower, shops, bike riding, car, bank. Yep.
Do you both want to come through? Who do I ask, Cheeky or you, Brenna?
I both.
Both, okay.
I've noticed some drops of blood today on the bathroom floor, so she is bleeding, not from her feet, I think from her genitals, so I was really quite worried about that.
Oh.
You sort of just have to tell her, not ask her. That's
Oh, really?
Yeah.
Got to be firm.
Yeah.
She's a strong woman.
She is. So if you just tell her what you want to do, she'll do it.
She likes assertive men.
She does.
It's always been a problem. Come on. Now, Cheeky, no. Yeah, you're going to get up there. Thank you. It's the way you go. It's how you treat a woman. So I guess a few drops of blood doesn't sound like much, but in a bird, that's...
Quite a bit.
Yeah, quite a bit. Okay. So I just want to have a good look at her. There is a little bit of blood around here. What's this going on?
Oh my God, what is that?
Chris has found the source of Cheeky's dangerous bleeding.
At the base of that gap is a hole.
Yes.
And that's where that blood's coming from.
Yes.
So I think she's actually lost a feather.
Sweet lamb.
What we'll do is just clean it up with some antiseptic and just try and clean around the base of where that feather's come out. So I guess we need to work out how she's done this, because the worry is that if she does this when you're not around or when you're asleep, and she actually has a decent bleed, she can actually get into quite serious trouble. So has she been doing anything abnormal behaviour-wise?
What Prem's struggling to say is that the naughty cheeky spends too much time self-pleasuring.
How often?
She does it every day.
Yeah. For how long?
Sometimes a lot every day, sometimes for 15 minutes.
15 minutes?
Yeah.
Cheeky is so incredibly sexually frustrated, so wound up, that not only is she pleasuring herself, she's gone to the next step. She's pulling her own feathers out.
What does she do it against?
There's a part of the twig that she always kind of backs up against. She stands on one leg to get like right in the right position. It's really funny. She'll like lower herself right down on one leg.
I think that comes under the title of a little bit too much information. Cheeky, get on the hand.
That's it.
So what is the solution to stop Cheeky's harmful habit?
She's doing that right now because the weather's just warmed up.
Yeah.
And because of that, she has all this energy, but also all these messages in her body saying, you must mate, you must breed. But there's nothing around her that she can mate with.
Yeah.
So what she needs to do to lower that sexual frustration is to convince Cheeky that it's actually not springtime. And the way you do that is actually lessen the daylight hours. Put Cheeky to bed in a darkened room at 5 o'clock in the afternoon. So Cheeky, sounds like you're gonna get the treatment you deserve. Early to bed like all bad girls. There you go. See you, Cheeky.
Elroy! No! Come on! Sorry.
At Bondi Beach, bad boy Elroy is giving his owner Bree a hard time.
My expectations when I bought Elroy were that he would be a quiet bundle of joy that would just kind of laze about. Unfortunately, Elroy is the most energetic dog that I've ever had. Elroy, come here. Sorry. I don't normally let him off the lead because he will just run off and jump on people and eat people's food. He's a nuisance, sorry.
Chicken burger.
Bree's called Chris for a beachside consultation to find out how to control her wayward bulldog.
I'm hoping that Chris can help. I'll do anything. No! He's too strong now, and you know, it was fine when he was a puppy. How could you not love him?
10-month-old bulldog Elroy is out of control. Owner Bree is hoping Chris will come up with some solutions to his bad boy behaviour.
Simplest and most logical step is the fact we've just got to get rid of those.
They're massive. It's unbelievable.
What we need to do is settle him down.
I know, I'm all for that.
Chris believes Elroy's testes are producing too much testosterone, leading to his dominant, aggressive behaviour.
Elroy!
Castration is often the answer for male dogs who are running amok.
Sorry. Me and my partner definitely do feel differently about Elroy and his masculinity. I would like to have him desexed. He doesn't want him desexed. He likes the look of Elroy being this big, strong, tough guy with rather large testicles. And I think, you know, he might have what he doesn't.
In terms of maintaining his manhood and making him look masculine, there is an option. A few years ago, a guy actually invented something called neutricals. They're essentially silicone balls.
No.
Seriously. Seriously.
Who thinks of these things?
Funnily enough, Americans.
CTA Neutricals.
Hi there, it's Chris Brown here. I'm a vet from Australia.
Hi, Dr. Brown. How are you, sir?
Oh, not too bad at all. Now, you're the man to talk to if we're looking for silicone testicle implants for dogs.
Yes, sir. This is Neutical Central.
Chris is talking to Greg Miller, the president of the Neuticals Corporation.
Is there more than one, I guess, model of Neutical? Can you?
We have four different models. The Neutical Original, the Natural, the Ultra Plus with scar retard, and the Ultra Plus with scar retard with the epididymis. They come in literally quarter-inch increments. So, I mean, we can get it down to a gnat's knee, I'm telling you.
Elroy's Neuticals come with a price tag of $380.
I think we'll go for the Ultra in the medium size for Elroy. That sounds about right.
We can get that order out today. Orders placed today, go out today.
How you going?
Hi, I've got a package for Chris.
That's great. Thank you very much for that. These are some well-travelled balls, that's for sure.
Elroy's Neuticals arrive at Chris's house.
Well, they're there. Here they are. So, Elroy's 2 new testicles. They look to be the right size. They feel about right. So, Elroy's big day, well, it isn't too far away. This is the Neuticals instruction manual. It's a very strange piece of paper. I'm sure customers would have had a good look at this. It's almost like IKEA. They give you numbers to follow and an instruction sheet about the steps to take to make sure you get the implant in the right way. So strange.
It's a very big day for Elroy and I. I'm actually really excited about it because I feel like it will be just so much relief at home and on our walks, and I'm hoping it will make a difference, yeah.
Elroy wouldn't be quite so enthusiastic about his trip to the clinic if he knew just what was in store.
It wasn't hard convincing your boyfriend that silicone was the way to go?
Not at all.
Just for the simple fact that he just had to be done.
I think every man likes silicone anyway, but he loves his personality, but he does realise that he's out of control, so it's definitely time to do something about it, isn't it, mister?
You are a wild child, aren't you?
That's them.
That's them there. Now,
They're kind of, I don't know.
don't say small. Don't say too small.
They do look smaller than his,
They're
though.
slightly compressed because they've been in air freight.
Okay, cool.
All right, we've got everything sorted now.
He's even too crazy to say goodbye to, aren't you? Huh? Goodbye. Bye, little one.
It's so loud. I guess the thing is that even though it's a slightly comical operation, there's a very serious side to it because he's going to be very tricky to get under anaesthetic and then keep her under anaesthetic.
All right.
Okay, that's all fine.
Because of Elroy's boisterous behaviour, it's an operation that has to be done.
I just don't really want to give him too many sedations to settle him down because it's actually going to make the anaesthetic a little bit more dangerous for him. Hey, buddy, come on. You behave.
Elroy. Good boy.
Elroy, come on. He seems to sense the critical moment, doesn't he?
The testosterone-fueled bulldog was out of control. His owner, Bree, wanted him castrated to settle him down, but her boyfriend didn't want Elroy to lose his manly looks. Chris came up with a clever compromise.
So we've got our first testy there. Now, normally I'm just taking it out, but now I've got to be pretty conscious of actually getting it out and leaving enough room to get it back in as well. Yeah. So that's one out there. All right, Mel, can you get me the first of the Neuticals thing?
Yes.
Okay. All right. If any wives are sitting at home looking at this, thinking that maybe their husband could go through a similar thing, think again. It's not that easily done, thank you very much.
You can sympathise with plastic surgeons.
The operation's turning out to be very delicate, and the Neuticals are a snug fit.
I think I said it before, it's a simple matter of pulling one out and putting it straight back into the place it came from, but we probably almost overestimated his size, and it's proving quite a challenge to get this one in. So now we've got the Neutical in place, we're just going to stitch it closed. It's just so tricky though, because everything's so slippery, and it's made the surgery actually very, very difficult. So we're 50% there, one down, one to go. Now with the benefit of experience, this one should hopefully be a little bit easier.
Elroy probably doesn't care right now, but he's a pioneer. Chris believes it's the first nudicles operation performed in Bondi, possibly even Australia.
It's not often you can claim to be the first to do anything in Bondi, so Elroy should parade these with pride. This is the final part where we're going to push the last one down into place. Once we've done these stitches, then we'll let Elroy wake up, and from there then he's going to wake up to find something has changed, but in a way something stayed the same as well. Look who's here. He's in about first gear compared to fifth gear normally, but he's...
Still groggy from the anaesthetic, it's a very subdued Elroy who's reunited with his owner Bree.
Isn't he very sleepy?
This is not Elroy. Oh my God, I can't believe how still he's been.
Different dog, isn't it?
I have never seen him this still.
Unfortunately, that's more to do with the drugs still being in his system rather than the lack of testosterone, but
I understand that.
over time this should be the Elroy you get used to. Do you think when you get home, your boyfriend could actually tell the difference?
I don't think he'll notice a difference. I think he'll be really happy actually.
Yeah.
So...
He'll be able to walk in with pride.
Yes, most importantly with pride. Yeah.